Right, so first of all, I'm going to put on that electrode and I'm going to plug that on there, and then I'm going to turn it on. So I'm going to just test it on your thumb and you'll feel like a little buzz.
Okay.
This is just to make sure. So what I'm doing, I'm putting it in the detect mode. It's on the lowest setting, right? 1 out of 15. So that is the lowest. So I'm just going to touch it there and you'll feel something.
Like a little tiny bit. Oh yeah, I felt that one.
You felt it, yeah? Okay. Right, so now I'm going to scan your whole hand.
Is it going to feel like that?
In certain places it will.
Alright, it's alright.
So I just need you to tell me where you feel that.
There, go up. Yeah,
right,
there.
so what I want you to do is with this pen, every time you feel something quite strong,
yeah,
do a dot for me, right, with that pen, so that we can go back and work on those areas. Not on there. On there.
No, do you want that though? Yeah.
Right, so that's like your lower spine.
Oh, one there and there.
Okay, just put the dots on. So this is like your spine showing up.
Oh. Oh.
Do the dots so you can see them though. Right, so this is your spine.
Yeah, I felt all of that, the whole line.
Did you suffer with your back?
Oh, a little bit, through a little bit, yeah, actually.
Let's do here.
Oh, I gave me shivers.
Are there any that are like really standing out?
Yeah, the ones that I've done really. Oh, yeah, that one. It's weird, isn't it? It gives you like twitches.
So basically you just cover the whole area. So let's just check these. There,
Oh, that definitely is there.
there.
Yeah, oh my god.
There.
Oh
All
yeah,
of
I am
these.
getting it right.
Yeah?
Yeah,
You can feel all of these.
yeah, oh my god. That's mental.
Okay, stop that. So what I would suggest is going to the ones that you felt the most. So what were the ones that were really strong?
Underneath my fingers and this one here, to be
Right,
fair.
so
I'm still
looking on this
feeling that
map.
one. I'm still feeling that one.
you're still feeling that one.
Tiny bit.
So that is like top of your leg, like hip.
Oh.
Do you have any problems with your left hip?
Yeah, when I sleep,
There.
I swear to God, I
Really?
get it on my whole leg, my bum goes numb, I have to turn around
That's
the
your
whole.
right. That's your right.
But both of them.
Oh, both of them.
But then
okay.
either way,
But saying
they've
that,
both
that's your
done
right.
them.
That's your right leg.
Yeah.
But that's probably a little bit lower down.
Yeah.
So what's
It's like on my hip stick too, yeah?
right?
My whole leg goes numb. I have to like turn each side. It's weird. I asked
I
the
told
doctor
you this
that.
is accurate, didn't I? Right. So this is leg.
Yeah.
Right. All of this is to do with like spine. Because
Okay.
look, this is
My back's.
and this
I'm
is
hunched.
hips.
Actually, I'm very hunched.
So this is hips, spine, legs, that sort of area. So what ones came up the most? What one would you say was the strongest?
Like these here. And what was that one? I was like, oh, was it this one?
I don't know. So should we work on this hip thing?
Yeah.
Because then you're going to notice the difference.
Yeah.
So I put it into the relieve mode. Put it on for 15 minutes, and we're going to start. Right. So again, this is on the lowest setting. Was it this one?
Yeah.
Right. Hold it on for me, but make sure it's in the right place
feel
where
it
you can
tingling.
feel it the most.
Yeah, it's there, right there.
So where can you feel it? Is it going right down your hand?
Yeah.
So what people find is, let me grab the phone. You carry on doing that.
Oh, oh, oh. like twitching, itching.
So what's happening is where you've got a blockage in that energy meridian, where the frequency is trying to get into that meridian, and there's a blockage, it's bouncing it back. That feels like a vibration.
Right. Yeah.
You know, it's like
yeah. That does feel like that.
So the more you treat it, you're clearing that energy pathway. You're clearing the blockage there, so that after you've treated it for a bit, you'll probably find that it's not there anymore because it's cleared it.
That's mental.
But ones that you work on and they don't clear, you need to work on more.
Keep going.
It's more of a chronic thing. But I mean, try these ones as well.
God, that's mental though.
Oh. But you do it because I can't feel like you, obviously.
Yeah, oh my God, my thumb's twitching. I can feel it going through my thumb.
Yeah. So that's like
Can you see
obviously
it?
we're
Is it
made
moving?
up. We're made up of meridians, like lines.
Can you hear it?
No. If you had a pacemaker, you wouldn't be able to do this.
What's a pacemaker?
You know when you've got that dodgy
Oh
ticker.
yeah. God, my whole thumb's twitching. That's mental. God, what's it like on the highest part?
I've not tried it on that. I've gone up as far as 2.
Was that like? Was it
Can I
bad?
try it?
Oh God. Oh. Yeah, put me back down to 1. God, what does it go up to?
15. Yeah.
Imagine being on 15. God, it does like, you can really feel that.
So this is all to do with your, like you say, when you're asleep and you're tossing and turning. So it'd be really interesting to work on these today. Just concentrate on them, and then you let me know how it was when you slept tonight.
Yeah,
Whether it's an improvement,
yeah.
and that's how it works.
That's mental. The third eye, what's that eyes on there? A few literal eyes. Left, right. Oh
Yeah.
my God. That's mental, and it just, is that sending things down to there right now?
Keep it more upright, so it's more of a probe.
Oh, right.
Yeah. So if we were doing this with needles, we'd be sticking a needle in that point, but we're not. This is non-invasive, so we're using that probe instead.
Yeah.
This is so good for people to just use themselves at home.
Yeah.
And I've had some amazing results.
Really?
On people. Yeah.
Should I keep it on there?
We'll just sort of flick between these ones, that one, and the other side.
Can't feel that one now.
See what I mean? So sometimes they just disappear because you've cleared it.
That's mental. Yeah, that one I can't even.
No? So you've cleared that already.
What?
So focus on this.
Yeah, that one was really bad. Still
How's it
there.
now?
Not as bad actually.
Yeah, so keep
No, it's
focusing
different.
on that, and that can be the one that we concentrate on.
That's mental. I wonder what it's like for the feet one. Do you reckon you could use this on the
Yeah,
feet?
you can do it on the
yeah,
feet.
yeah.
Yeah. It's just easier to do on your hand though.
Yeah. Is it the same thing?
Yeah.
Yeah, no matter
It's
if
like-
you do it
it's
on the
like-
hand or the feet, it does the same thing.
Yes. I mean, I've actually tested it out doing both hands just as a test, and I had the same come up in this hand as
In
that
that
hand,
hand.
which I thought, oh my
Yeah,
god,
that's mental.
that is a good test.
That isn't as that now. I stopped with it.
Yeah, so that shows that it's not a massive problem.
Right.
Whereas
that's
if you
good.
did it for ages and it was
It was
still
going on,
bad,
so something's going on
that's
there.
quite a big blockage that you
Yeah.
need to work on. But if you're getting rid of that in one session, that's not a big problem. But you're young
Literally.
anyway. You're young, and
That's mental, because a minute ago I was really feeling that, and that.
now it's nearly gone.
Yeah, I think it has.
So I'll be very interested to hear how you sleep
Sleep
tonight. You better tell me,
No, I will.
like a baby.
Yeah.
Hopefully.
Hope I don't. Do you know what it is? I'll go to sleep, then I'll wake up. I'm like, oh, my bum really hurts. Like, it's like numb. I can't. It's like,
Right.
goes like pins and needles kind of thing.
I mean, what's your bed like? Keep it up.
Quite good bed to be bed.
Yeah.
DFS, all that. I've got quite a lot of money for it, but
'Cause sometimes it can be the bed.
yeah, that's what I thought.
Mm.
I did think that. But then I've gone to sleep in other people's beds that really can't think it still
It
happens.
still happens.
Mm.
Right. But then there's also these ear clips. This is a whole nother treatment where you clip them on and this stimulates the vagus nerve, which is the longest nerve in the body, which is responsible for loads of different bodily functions, including digestion. So they call it, because it stimulates the have you had a parasympathetic nervous system? It's the rest and digest, they call it.
Oh, right.
So when you put them on, you do minimum an hour a day, maximum 3 hours a day. So you can do an hour, an hour, an hour. And this really helps with so many things. I mean, when I was, first time I used them, my stomach started going, "Arr,"
Really?
and I was thinking, oh my God, it's actually digesting.
What?
A lot of people have got damage done to them since COVID. So this helps to repair that damage. And this helps you have a good night's sleep. It's good for anxiety. Because these are like electromagnetic waves going through the body, and it stimulates the vagus nerve. So this is another treatment that you can use with that.
With that, yeah.
So that's another plus point.
Yeah, I can't feel that now if I just moved spot.
That's why it's good to mark it with a pen, and then you know exactly where to go. And this is another thing.
No, that one's finished, I think.
Is it? That's
Yeah.
good. This clamp, see it's got a probe in there. If you can't be bothered to sit and hold it, you can just
Oh, that's brilliant.
clamp
Hold
it,
it like that.
and then you've got a free hand.
Oh, that's good.
Otherwise you're sitting there like that.
Yeah, or for 15 minutes on each one. Yeah, that one's done, you know. That is off, or is that still on?
No, it's still on.
Yeah, that's done.
So try another one then. Try more spine stuff. You feel that?
Yeah, but not as much as the other one. It's very faint.
Yeah.
Maybe that sorted all them ones out.
Yeah, I mean, could be the same meridian. So
that one is faint, this one here is very faint.
So when I first got this, right, I've always thought I had bladder issues, right? Because I get UTIs. And I thought, can't wait to try this out. So as soon as I got it, I was like going over my bladder area, and I was thinking, I can't feel a thing.
Really?
That's a bit weird. But then when I did down here, which is urinary tubes, I was like,
no way! So that all made sense.
And I thought, oh, I thought it was my bladder. It's actually my tubes.
That's mental.
So it means I can pinpoint my
All your
treatment.
Problems, yeah, start doing it yourself and you see a
rather
difference.
than-
Then
exactly.
you'll know, yeah.
So it's more accurate than anything I've ever tried before, because it's made me realise it's not actually my bladder, it's my urethra tubes.
I'll go around there a minute, see if there is any. No. So what can you do for things to help you doing things for that, the lining of that?
I'll just keep working on that point all the time.
Wicked, yeah.
So basically I just clip that on.
Have you felt a difference?
Sometimes it feels less, but because it's a chronic 10-year-old problem, it's not going to go overnight.
Yeah, of course.
So you just keep working on it, and like working on it every day. You can do it every day, twice a day, but leave 1 day a week where you don't do it. Have a little break. Do you rate it?
Yeah, I do, 100%.